Welcome back. I have to tell you, as brothers and sisters and as our neighbors, because we know that this program, this event, is not only going out to our own communities, our own masajid, but that we have many friends. We are developing very important partnerships, and that relationship is becoming increasingly precious and valuable. So we'd just like to welcome everyone to this next segment of this incredible event, MMCC Day of Goodness, the first of many, God willing. In this segment, as you already understand, we're going to focus on the issue of social services that are being provided in Michigan by a number of different agencies that are partnering with MMCC. And it's my great pleasure and honor to welcome to our event today Dr. Wasim Rathor. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Dr. Rathor, I know that you have played a very important role in the development and in the ongoing operations of Huda Clinic. Now, Huda Clinic, as I understand, is located in a very strategic location.
Yes.
With regard to the incredible human services challenges that Detroit and Michigan have been wrestling with over the last so many years. Could you please give us a little bit of background, a brief history of the development of the Huda Clinic?
Sure. So, Bismillah ar-Rahman ar-Rahim. Jazakumullah, Brother Dawood. First of all, I want to congratulate you for holding this wonderful event that you're doing. Very much needed for a long time. Alhamdulillah. Through this platform, you're bringing all the community together. So, having said that, of course, like everything else, Huda Clinic, which first I'll tell you a little bit about the name. Huda, coming from Arabic, meaning guidance. And then we held the clinic, or we started the clinic, the location was Davison Avenue. So it stands for Health Unit on Davison Avenue. So alhamdulillah, we were able to combine these two things. But anyways, it all started like almost, I would use the word, a wild idea. In my dining room about 12 years ago, a few of our friends were together for dinner, and it was like, okay, everybody was talking about what they're doing. So I just said, you know what, we all talk the talk, it's time to walk the walk. And then one of my good friends, Dr. Zahid Sheikh, who is an ER physician at Henry Ford, said, he met with me later and said, let's do something. So that's how it all started. So I had volunteered at the Soup Kitchen in Detroit, where we started the clinic. So we met with Brother Mitchell Shamsuddin, and that's how it all transpired. We got a space in the upstairs part of a Muslim Center in Detroit, West Detroit. Very much needed the medical help. And I'm talking, this was started about 10.5 years ago. So the community was suffering in many respects, no resources even for meals. So that's where we started. Upstairs, we got a room, and that's where we started 1 day a month. And initially it was 2-3 of us doctors and a couple of residents. You had mentioned Dr. Faisal Qazi. He was a resident and a medical student at the time when we started, and he was part of Huda Clinic. So he's one of the pioneer guys here at Huda Clinic. So we used to go around, drive to doctors, our other doctor friends' offices, collect medical samples or pharmaceutical samples, run the clinic. So I'm just giving you a brief synopsis. So slowly we evolved, and from 1 day a month, every one Saturday a month, we got to every other Saturday a month, and then slowly increased. And then we slowly got to every Saturday of the month.
You didn't do it? Okay.
And in that perspective, of course, our needs started increasing. So alhamdulillah, we've been successfully operating there in the Muslim Center. Now we have moved. We were able to acquire, again, with the help of many other organizations and individuals, including MMCC as a big support from the beginning up till now, acquire a building across the street because our needs had increased. So alhamdulillah, we are operating there.
Excellent, Dr. Rathor. You know, from your description, what I'm hearing is a real grassroots effort where there was a critical need identified in one part of the community, and a response not only from the Detroit part of our community, but from the larger community. And people that had resources and people that had skills have come together to create what is really an incredible institution. I visited Huda Clinic while it was in operation. And I mean, it really almost brings tears to my eyes. Could you please describe a little bit the services, the critical services that Huda Clinic provides to the community, and who benefits from this clinic?
Sure. Let me give you a little bit of background and then I'll take you into it. When we started the clinic, as I said, we were open just little, once a month, then we increased to every other week, and then once a week, and now, alhamdulillah, we are open 4 days of the week, actually 5 days almost, 4.5 I would say. And when we started, it was all just volunteering physicians and other volunteers, non-physicians, to support us. And then as the clinic grew, the needs grew, we hired like a clinical staff, like an office secretary to make the call, to receive the calls, to make the appointments if we can, and then a nurse. So at this point, our staff consists of actually mainly volunteer physicians of all different specialties. Paid staff is basically the support staff, which is office secretaries, medical assistants, and then other security staff and those people. Our critical services, we started with just the primary care services initially, but now alhamdulillah, we are maintaining successfully the primary care services regularly. And besides that, the specialty clinics that have started are ophthalmology clinic, which is the eye clinic, psychiatry clinic for mental health purposes. We have a dental clinic that was recently started. We also have a dermatology clinic that is run once a month. And recently we have unofficially, I would say, started an endocrinology clinic. So basically dealing with, mainly in that region, diabetes and all of that. And that is a very important disease to deal with because it has very long-term repercussions, and intervention, early intervention and lifestyle modification is far more beneficial than just treating the disease. So in that, education of patients.
And from what I understand, my wife is a nurse by training, and she has an intense interest, you could even say a passion, about the issue of diabetes, which has really become epidemic. By the same token, my sense is that it's symptomatic of poverty, because lower food value, an incomplete diet can create to challenges of obesity. I mean, just so. Could you share a little bit of understanding, maybe a bit more on that, but I'm also interested about the issue of mental health.
Sure.
Because we're being taught today that stress in itself creates a chemical imbalance. And so Rasulullah sallallahu alaihi wasallam has taught us that poverty is a piece of fire. And I think we can see that reflected in this pressure cooker that so many families are living in today, just concerned and afraid where they have food the next day or even where they're going to sleep. So the medical services, the mental health services, it seems to be so incredibly valuable in meeting our obligations as a community. And it's our community members that are being served and the neighbors of our community members as well. Could you share a bit more about the development of this area of work?
Sure. I will touch base on all these 3 points, beautiful points that you brought. And again, try to keep the medical jargon out of this discussion a little bit.
Thank you.
But definitely, as you said very well, we surveyed our own patient population, and the 3 main diseases that we are treating the most at Huda Clinic are diabetes mellitus, hypertension, and I'll use an umbrella term, mental health conditions.
Okay.
These are the 3 biggest things. And then of course, with all these, you get high cholesterol, or high cholesterol is part of it, and then many other conditions. So, and Sadly, or however it has been set up, all these things are tied to lifestyle and socioeconomic status also. So there was a perfect need for these things actually in that location, because relatively low socioeconomic status, and a lot of times, as you very well put, we see patients who have tears in their eyes because they have to make a choice of having their next meal or taking their medicine.
Subhanallah.
So, and that coming from the Ummah of Rasulullah Sallallahu Alaihi Wasallam, that breaks my heart, because we, the Muslims in Baghdad, were the ones who started the concept of hospitals. We started the concept of waqf, meaning free health services to all, not just Muslims, to all living in that community in Baghdad. And so we all felt, I mean, this is the vision of us, all of us working, not just me, that we need to live that sunnah of Rasul Sallallahu Alaihi Wasallam and try to provide that.
Barakallahu fika akhi. This is such precious information that you're sharing. I appreciate it very much. Let's increase our audience's understanding of some of the institutions that are partnering with Huda Clinic and with MMCC. We have another video and would like to share this with you that talks about this area of work of social services and MMCC.
MMCC has really found an important role in helping community organizations providing great services, whether it's women who are victims of domestic violence, whether it's children in foster care. Our goal is to identify wonderful work that's being done in the community and then channeling Muslim communities' resources to help them. And I think that is a critical role that we're very happy to be able to fulfill.
This organization was established to serve not only Muslims but non-Muslims alike.
This is the first Muslim transitional home in Michigan. None. Before, our sisters used to end up in a shelter home, which is shared by 50 women, same bathroom, no halal food, nothing like that, So now we have, alhamdulillah, for the first time in Michigan, we have a transitional home for the sister who can take shelter, and it's a beautiful atmosphere, We provide them food, education, and all different kind of training so they could be on their feet and to be a productive citizen.
For recipients, it's a relief. Relief, emotional relief, psychological relief, marital relief, and financial relief.
It's important to make sure that the Muslim family is strong and remain one, because in the strength of the family is the strength of the community.
Unless you have a professional counseling to the people, you cannot issue the root cause of their problems, So where would they go? They have to come to the professional counselors who know the background of this society and also the background of the Islamic perspective.
Muslim historically and traditionally have been very involved in healthcare. It's part of our tradition of our Prophet.
Huda Clinic is an extremely successful project. It started with at the Muslim Center with a couple of small rooms on the second floor. We worked with them, we supported them, we raised money, and with the money that we raised, we helped them purchase a new facility that's bigger, much larger and more like a true clinic.
Tending to the sick, ill, keeping them healthy, keeping them productive is overall in the long term good for the society. People with the heart and the soul should look at this as a place where is absolutely no question what we do is important.
They provide service free of charge for people who cannot afford to see their own doctor. And that's part of the Muslim belief. You help people who need.
We have approached MMCC at various times. They are good boosters of us and promoters of us. And we are very proud to be associated with them.
Really important for us as an organization to have these kinds of close relationships with organizations such as MMCC. And for right now, it is a prime mover and shaker for us as an organization.
I think it's important that community organizations work together, such as Huda Clinic, such as Muslim Family Services, Zaman International, the soldiers on the ground that are doing the work. We certainly need the monetary support. And then also there's the opportunity for youth in the community to have volunteer outlets and places to get their community service hours. So it creates a win-win.
I want to assure everybody that the mission of Huda Clinic is sincere and pure, and whatever we do is for the sake of the poor and the uninsured, and there's no other reason for our existence here.
You have to look at the work and both organizations doing this humanitarian.
In order for us to provide the services, we must receive enough funds to meet our goals in supporting all these community services, which are vital for the humanity, and also it's important to serve the Muslims.
Welcome back. I hope that you can understand now why I'm so excited about the opportunity we have to present such professional videos. It's needed in order to convey in the best way the magnitude of the work that's already underway. We're blessed to return to a bit more conversation with Dr. Wasim Arathar. Dr. Arathar, let's talk money. This is a free clinic.
Yes, sir.
But the work isn't done for free.
Absolutely.
It takes money. Could you talk a little bit with our audience and with me, because I'm being educated also, about what it takes to present a project like this? And I know we're talking money, but if you could slip just a little bit of information in about the interfaith opportunity, because I think we've had some partners from other parts of the faith community as well.
Sure. Absolutely. As you said, it is a free clinic, and that's our mission statement when we started, to provide free health care to all. So as part of that, we are working on catering people who have no health insurance and are indigent. From that perspective, currently, I will just cut to the chase, currently our operational cost is roughly between $250,000 to $300,000 per year.
Wow.
Now this cost, I want to just mention this clearly, the most expensive component of any healthcare service is physician and then inpatient services. So that part is free here. Mm-hmm. So this cost is mainly going towards medication, because we purchase medicines and we dispense them free to the patients, and then other diagnostic and laboratory services. And then, of course, supplies, like running a dental clinic, you need a lot of supplies. And of course, as you had mentioned earlier, we provide free health care to any and everybody that comes over there. Mm-hmm. And statistically speaking, our actually non-Muslim patients are greater than 60 to 70%. So, which alhamdulillah is a perfect form of da'wah. I mean, da'wah is not just, I'm not trying to downplay what's standing on the pulpit and speaking of Imam. That's very, very, very important, reaching to the people individually. But I feel this is a passive form of da'wah, that alhamdulillah, not all, but majority of the physicians that are working there are Muslims. But we have a lot of non-Muslim partners, physicians also, who volunteer their time.
Including from the Jewish community?
Including from the Jewish and Christian community.
Christian community.
Yes. And alhamdulillah, it's growing very much so. Now, these funds are definitely needed, going back to the funds, to run these services. As you said, mm-hmm. It's a free clinic, but it doesn't come for free. There's some cost to it. So by the mercy of Allah, Allah has blessed us with partners like MMCC, IAGD, and many individuals, if I start naming, there'll be a long list, who have supported us all along, especially MMCC. I want to mention this, that when we started our clinic and a few years into it, when we expanded, our costs increased. MMCC, at that time ISCOM, was there to support us with our operational costs, and then the big support when we needed, when we transitioned into buying the new building, getting out of the rental thing into our own building. MMCC was our support. So I feel I cannot say enough that, again, now I'm transitioning, living in southeastern Michigan or living in this world, like the Sahaba of Rasulullah Sallallahu Alaihi Wasallam. Rasulullah Sallallahu Alaihi Wasallam was a perfect personality, as we all believe.
Ameen.
And Sahaba were, Allah had blessed each one of them, just like that, each one of us with different qualities. None of us is perfect in all aspects.
Right.
So we need one unifying factor or organization that brings us all together. And I feel MMCC has provided that to us. And I feel that MMCC has supported our project with our clinic. So by supporting MMCC, we support all the projects.
Let me slip another quick question in. Dream. What difference would an additional $50,000 in your budget or $100,000 in your budget, which is very doable from this event today, what difference would that make? What could be done with that additional financial capacity that isn't being done now?
Just with $50,000, we are currently open 4.5 days a week. We can be open 6 days a week.
Wow.
That's one thing. And with 100,000 or more, my wish list is endless. There's no bottom to it. Of course, right now we have our own building, which was an old church that we acquired, and we made some makeshift rooms. So, of course, our desire and dream is to turn this into a world-class medical facility. Of course, that requires money. So with $100,000, actually not just 100,000, if just for
that's the beginning.
Yes. So between $100,000 and $200,000, we can make this into a state-of-the-art facility like you go to in suburban medical practices. So yes, and you can do a lot of interesting things and provide health care to a lot of uninsured. And now we are looking at revisiting our mission also, our vision also, where we have a lot of uninsured, but we have a lot of underinsured now. With the Accountable Care Act, there's a lot of good things, and one thing is we have a lot of underinsured people.
True. But there are also, in our community, including our neighbors, even with the new legislation, there are parts of our community that still don't have insurance, still don't have any coverage. And we have people that are so vulnerable in a homeless situation. And these are our brothers, these are our sisters too. And they're so exposed. But let me ask you a question with regard to what you know about your partners, other organizations. Like I know that the Muslim Family Services does a lot of important work. Could you share a little bit of information about the good work that they do as well?
Muslim Family Services had been there way before Huda Clinic was even thought of. And alhamdulillah, Sheikh Ali Suleiman and all his team has done such an amazing work, and this is very much needed work. And in the beginning, even now, before we even started our own mental health and psychiatry clinic, we were utilizing the resources of Muslim Family Services. There were patients that needed that support and social work support or social support. We would refer them regularly to Muslim Family Services. We would communicate with them, partner with them in this way, learning ways how to deal with this situation. And actually, having said that, when you asked me about the wish list, that is one of the biggest wish lists we have. Community education for better lifestyles, so improved health outcomes, and social work services, which are very much needed by Muslim Family Services as well as us.
Yes. You know, Dr. Wasim, as the work of MMCC expands, and in fact, the approach that we're taking is as an umbrella organization to build a voice for the Muslim presence in Michigan. But in addition to that, we're working to strengthen these grassroots connections, the community relationships. We have such incredible work that's been happening through the different masajid, the different institutions. By the same token, so much of it seems to have been happening in silos.
Yes.
And we know that part of the basic teachings of Islam is the difference between the incredible efforts of individuals and yet the multiplied blessings and impact that can come from working together.
Very well said.
So as we look about strengthening the work of our institutions, we're going to continue to look for leadership from wonderful individuals like yourself. I would like to request you to speak, as you already are, from your heart, about the commitment that we have to build inclusion in all of our work. I understand from having spent some time in the neighborhood that Huda Clinic is based, as well as in the neighborhood that Muslim Family Services operates. And in fact, Brother Ibrahim Vaid, who along with Imam Ali Suleiman Ali, who will be sharing some information in our next taped segment, when I visited them, I was asking about their capacity, and they were very concerned about additional publicity, which may seem strange, but they said that when they have food or they have clothing or something to share, the need is so great that people will line up, be around the block, and they're concerned that people will come and they won't have the capacity to give. So we understand that this is a partnership with people that are living, that are serving, that are from that part of our community. Can you please share with us once again how this partnership has played a role in establishing the strength of Huda as a community-based neighborhood organization that is serving Detroit and all of its people?
You have said it so well, and I would definitely share that thought with you that every time, as I mentioned, we have this specialty clinic, that specialty clinic opening or working in Huda, and every time we are starting a new service, we are all excited about it and we're gung-ho about it, but the one fear or little twinge in the stomach we have is how we are going to afford the service. And so of course, we reach out to our partners and our donors, and hopefully up till now with their help, we've been able to do that. But partnering with other organizations, which in the past have been very helpful to us, including again, MMCC, IAGD, Blue Cross Blue Shield of Michigan, actually we have been able to get few grants from them. So it is always so great and refreshing, like we are all trying to tap our individual resources when somebody, whatever you want to call it, like a big brother. It reminds me when I was a kid, you know, not a little kid, but a little grown-up kid, and you thought that you knew it all and you were doing everything, and then finally, but you got in trouble, there was your father there to bail you out. So this partnership to me is almost like that, you know, and as you said earlier also, you know, individually working in silos or individually, everybody's doing great thing, but when you join hands together, that I feel Allah puts His barakah in it too, and then it amazingly grows. And it is so refreshing to know, as they say, somebody got my back.
Dr. Wasim, here in just a couple of minutes, I'm going to be speaking to all of our audience again with regard to the importance of their participation, their contribution today. In the few minutes that we have left, could you please, from your position in the community as a respected physician, someone who has been blessed with financial resources and who provides leadership and an example when it comes to giving, could you please speak to that part of our audience today, whether they are living in Michigan, whether they are Michiganders that are living in the United States, or to our global audience? Could you speak to the potential major donors from your own experience about the value, the benefits, and why it's important. It's a special opportunity today for them.
Sure. You've said it very well yourself, so I find hard looking for the very words. But in every perspective, I feel that supporting individually makes a difference, but when we come together as a group, that makes the biggest difference. So I feel I am seeing the fruits of this unity or this umbrella or this coming together. And we don't have to keep it this is not a secret of southeastern Michigan. This can grow throughout this North American nation and the world for that matter. So I feel that we should all be generous enough and open our hearts and really come out and donate. And we have all heard it from pulpits or stages many times. You give one, Allah gives you 70 times. Whatever you give, you are all returned. And we all, including myself, have seen that whatever you give and you're like feel that you're stretching yourself, in a very short time, Allah subhanahu wa ta'ala makes up twice or multiple times of that, and then you wonder where that came from.
Allahu Akbar.
So sharing, as in our culture, they say, your sorrows decrease with sharing, and your happiness and blessings increase with sharing.
That's profound.
Yes, so I think there's no better way to say it. You've said it, mashallah, very well. So I feel an urge to our community, whoever is listening to this, that we should open our hearts and pockets and donate to the program. And
thank you very much, Dr. Wasim. I'm going to use that as a segue into our next segment and just emphasize, reiterate the point that Dr. Wasim is making, that we are ready to welcome major grants, major contributions. And we ran out of time, but I would have loved to ask Dr. Wasim what he would have done at Huda Clinic with $1 million contribution. Because I have no doubt in my mind or in my heart that in our listening and viewing audience today, that we have people with this capacity. Major institutions oftentimes are established through those major contributions, through the generosity of an individual or of a family. Now we understand that we're in a process of building the trust and gaining credibility, but with partners like you see in the videos, like Dr. Wasim represents today. This is very clearly a place where it is beneficial both materially and spiritually to become a partner and to give fi sabilillah without fear. By the same token, I have seen so many times through my 30 years plus experience as an Islamic worker that it is the small contributions that have the heartfelt commitment that maintain the institutions, above all, maintain the base, maintain the organizations and the staffing and the programs that are required to allow this work to move forward. So with that, I would like to invite a very short break, and we'll return with our next programmatic video. And may God bless you, Dr. Wasim Arathar.
God bless you as well. Thank you so much.